Hey, good morning or afternoon or whatever time it is for you. This is another Ask Dr. Bob, and I have several questions, very interesting questions. Actually, I love this first one. I have a question for you. If you have a thyroid condition, are there any foods that might help the thyroid gland work better? And I also want you to know that many times people have been told there are foods called goitrins. Goitrins are foods that actually, they say, complicate thyroid function. Soy would be one of those foods. They also have mentioned broccoli, cabbage, and cauliflower, but I want you to know something. Only 14% of you in the whole world eat, in the United States especially, eat enough fruits and vegetables in a day, but it's estimated 1/3 of the world has a thyroid deficiency. I would say eating broccoli, cabbage, and cauliflower is okay as long as you don't eat it exclusively raw. Saute it, steam it. Other foods that would be helpful to the thyroid would be any kind of known seafood and or sea vegetable. I learned this from a friend of mine who happens to own a health food store in the area, that buying or purchasing sea vegetables from the New England area, this is a very important point by the way, would be a lot wiser than buying sea vegetables that would have come from the Pacific Ocean because of the recent tsunami that we had and the radioactive exposure from Japan. So sea vegetables. Any kind of known ocean fish. Because see, a lot of fish that you think you eat like tilapia, it's farm raised. We don't promote tilapia. I want you to eat fish because you're looking for the iodine. Iodine is really important. And I'll tell you something else that will help thyroid is you want food that has zinc in it. That would be animal products that have zinc in it, pumpkin seeds, because we find many times that subpar thyroid function is due to a lack of zinc, high copper. So high copper could be caused by wheat and soy. So you want zinc foods. Pumpkin seeds would be great. Any kind of seed would be good for the thyroid gland. You want to make sure you're having oil. Oil is also important for the thyroid gland. Walnuts are important. Flax oil, any kind of good marine oil like anchovy or sardine oil. So that is really very important. Now, hyperthyroid. We've had patients that have had hyperthyroid. That question continued on. With that, we use selenium, a product called Enzyme, and vitamin E Forte, which is a liquid drops. We usually have our patients do 3 times a day. Hyperthyroid is, you need to have some consulting and you want to really work with somebody in that regard. What do you do for irritable bowel syndrome? So that's question number 2. Number 1, we would do a diet journal or history. We would want to see if they're consuming dairy or wheat products. Those are very common when it comes to irritable bowel syndrome. You know, there's a test that you can do called the adrenal stress index, and if someone's gliadin level is elevated, so the adrenal stress index, which is saliva testing, we're looking for elevated gliadin. If the gliadin is elevated, we know that you probably could have some challenges with gluten. So I'm just throwing that out to you. Irritable bowel, get off of dairy products, get off of gluten, rye, wheat, oat, and barley. And by the way, caramel coloring comes from barley. Caramel coloring is in diet soda, and actually even in brown bread. So we would also probably have you fill out a toxicity questionnaire in our practice. We would do some biocommunication with a galvanic skin response to see what foods you're really sensitive to, and even a saliva or a blood test, food allergy testing. Really good question. The next question is, how can I help the skin on my face not be red? Well, the condition name often is called acne rosacea because you're inflamed. Now, Dr. Nick Perricone wrote a book called The Wrinkle Cure. He talked about a process called glycation. Glycation is when sugar and protein come together. That's why we don't promote yogurt, because yogurt has a lot of sugar in it. At least American commercial yogurt has a lot of sugar in it, and so does ice cream. Causes inflammation. I had one lady that had acne rosacea for 7 years, and she coughed constantly for 7 years, and we did our assessment to her. She had exhausted adrenal glands, and she loved sugar. So I'm going to go back to the adrenal stress index. It's a saliva test. It's a test that we can do to check your cortisone levels. Your cortisone is low, you're going to have inflammation. So if you have a red face, now, if you have a red face because of blood vessels that are very large, you could have high blood pressure, you could also have congestion of your liver, and you might smoke. People who smoke don't have enough sulfur. Sulfur itself is important for connective tissue. If you had your tonsils removed, your tonsils are your storehouse for sulfur. I'd encourage you to get Dr. Bob's Drugless Guide to Balancing Female Hormones, because we talk about body signals in that particular book. Here's another one that's really common, and I see this in patients. They come in the office as new patients and they don't know what to do about it. It's cracked heels. The soles of your feet are okay, but your heels have cracked skin. This might sound really silly, but it's a low thyroid gland. It impairs the skin integrity. So you know you'd want to have a TSH, a T3, a T4. Those are the blood tests that we use for thyroid gland. If you do a lot of swimming, bromine, fluorine, chlorine are antagonistic to iodine, which cause low thyroid. I take 12 milligrams of a product called Iodozyme every day. And especially during the change of the season, you know, if it's spring, the summer, or from the fall to the winter, your thyroid gland can get compromised and you can get body signals for that. Cracked heels, think thyroid. You know, you can go to Drugless Doctor. We can send you a kit anywhere in the world. We could have your thyroid gland tested. My breath is real bad. I want you to think that your stomach is nestled right in here, and off your stomach there's a big tube. It's called your esophagus. So you could have bad breath because of putrefaction. That is when proteins break down. It putrefies. It's a terrible exhaust. Gas comes out of your mouth. Fermentation is when carbohydrates ferment, like if you eat fruit after a meal. Dairy products is rancidity. Watch how you combine food. You don't want to mix, for example, animal tissue with a starch. That means a sandwich, for some of you, especially blood type A, could be an issue. You may need a digestive enzyme. We use a digestive enzyme called Hydrozyme. Hydrozyme is a product that we use to help promote digestion and the pancreas. Don't use ice water with your meals. Don't drink dairy with your meals. It causes stagnation of your stomach, which is putrefaction, which will cause bad breath. And of course, you could have a bacteria building up in your mouth. I actually use a product called Agricept L, 10 drops in the water. I drink it in the morning, but I swish it in my mouth because they're finding a lot of joint problems today, and heart could be from bacteria in the mouth. Okay, why can't I sleep through the night? Here's number one. If you have a problem falling asleep, you may need calcium. Stop watching TV before you go to bed. Stop being on your computer. Let your brain have a simmer down time. Just let it. Let's say you go to bed at 10, you have a hard time falling to sleep, you could need some calcium. 4 to 6 calcium citrate. We use a product called Calmagzyme. If you have freckles, that means you have high copper. When you have high copper, your brain is moving around 1,000,000 miles an hour. You're going to have a hard time falling asleep. You may need some zinc. If you go to bed at 10, you wake up at 11, you might need some B vitamins. B as in Bravo. If you go to bed at 10, you wake up at 1 o'clock in the morning, and you grind your teeth at night, it could be parasites. If you go to bed at 10, you wake up at 3 o'clock in the morning, you're going to want to watch this video over again, by the way, and pass it on to a friend. You might have a blood sugar stress challenge. Now, this is really common, by the way. We use a product called Bioglycozyme Forte. 2 at 10 o'clock in the morning, 2 at 3 o'clock in the afternoon, and 2 right before going to bed. And the last question, why should I drink Diet Pop? Well, I'm going to tell you right now, you shouldn't drink Diet Pop. If you look at the ingredients of Diet Pop, they have something in it called sucralose. Sucralose is Splenda. If you look at Diet Pop, it has caramel coloring in it. Caramel coloring is barley. So I'm going to tell you right now, I would not drink Diet Pop, and I would drink regular pop if you're going to choose any kind of soda, but a Nutsen, which is a grape juice sweetened beverage, is a better alternative. Thanks for watching. Pass it on. Bye.